Hey, welcome everybody as you're coming on, and great to see some familiar names. And I think it's obviously we're in the summer mode here in August, but life still goes on. And I think our recent blog, Disability Doesn't Take a Holiday, and the need for supports doesn't take a holiday. So I know some of you've been on off and on over the couple of years and still facing some of those barriers. So the next 2 weeks, we're going to be talking and recording these sessions about promises kept and not kept. And this week, I'm pleased to have Christine Stanton with us, who's from the South Shore, and she'll talk about, her story and her son's story, and just what she's facing in the Promises Unkept area of turning 22. And she's not alone in that, but it's profound, what folks are facing. And we'll also have Senator Mike Barrett with us to talk about a promise, hopefully, well, for sure kept because of his work to try to address things from the past that need to be memorialized and recognized that happened to people decades ago and potentially still continue potentially to happen. So glad to have you all with us. And as we wait for Senator Barrett, I'm thinking, and people start to populate, I'm thinking maybe we will start a little bit with you, Christine, and begin the conversation. But what I want those of you that are also waiting and that'll be coming on to talk, share your stories, what we really also want to do is get emails from you so we can help follow up on your stories, like we'll try to do as well with Christine's, and do some follow-up. And one of the things I can share with you, we've been talking to DDS about, is having different areas host problem-solving sessions during this period with families, having call-in sessions. So not just one by one, but in small groups, so they can be some local group problem-solving as well. And that has not taken place yet, but I know people are getting individual support in different ways, but that's what we're going to learn about too as we talk. So why don't we do that? And I think Senator Barrett plans to stay with us for most of the time as well. So I think we'll be fine. And let me just pull up the PowerPoint and get us started with that. So Christine, I just want to say thank you for being with us. Really appreciate you taking the time. I think you're on vacation too, right?
Just a long weekend.
Long weekend. So I think that's great. And it's good to re-energize, as Kerry said. We were talking a little earlier. So today's August 8th. Welcome, folks. Promises kept and unkept. And I'm going to shoot by the initials. We'll go back to those. I already shared with you, we got two sides of the ledger today, right? We're going to talk about the amendment that recently came through for Senate Bill 1257, and it has a House counterpart, and that became part of the budget. But we also are going to hear from Christine as her son, Luke, believe it or not, graduates next week, right before turning 22, the day before, right? And they have no idea right now what it's going to be like. And Christine, you have a full-time job as well. So let me unshare and get you on talking with folks. And why don't you share a little bit of where you're at and sort of how you discovered the situation, when you first realized?
Well, good afternoon, everyone. Thank you so much for allowing me to share our story. And I just first want to say that I know I'm not alone, and I know this is a severe crisis with affecting many, many families, and something really needs to be done. Like Leo said, Luke is turning 22 August 16th, so next Tuesday. So he graduates Monday, August 15th, from the New England Center for Children, where he has been in the DAYS program since he was 3 years old, so 19 years. Wonderful program for him. As people may know, very well-run school for autism, highly structured, you know, small staff to child ratio. It was very good for Luke. And I was so pleased that he was able to attend for all these years. So I consider myself somebody who's connected with autism, with the world of autism in Massachusetts. Not talking politically or monetarily, anything like that. I'm talking about networking. And I got Luke involved in almost every family support center, family autism support center in Metro Boston, South Shore. We even, during COVID, participated in Zoom programs with Bridgewell up on the North Shore. I seeked out every opportunity that I could to get him involved in any social rec program, really, that I could. I started beginning to investigate transition around the age of 16. NEC had found vocational jobs for him first in the school setting. They have a school store and different jobs at the school. Then he was able to transition out, which I was very pleased with their efforts. He has been working at Walgreens 2 shifts a week since 2017, but he does go with his one-on-one teacher from New England Center. So he's unable to work, he needs guidance. He has a diagnosis of autism and intellectual delay. So he's not a kid that's going to be able to drive, going to be able to take courses in college level. We're talking someone who needs supervision for safety and direction and skill building. So entering a work program is not, I don't feel is really an option right now.
Or like even full-time, you could do part-time with coaching. Is that the job coach?
I think he does now.
Yeah.
But, you know, I don't know if he could do it. As far as I know, a lot of the work programs and adult services, you have a job coach for a certain period of time and then they fade. I don't feel that he would be someone that would work right now in the short term.
But he has a job coach or has had one through NEC and they stay with him the whole time?
Correct.
Okay, yeah, so, and who knows, like as he develops, right? Because we had a situation when someone transitioned that people in the adult services program, a really strong staff person questioned the gentleman's ability. And now, like 6 years later, he's there without a job coach all the time. So, but they questioned because of things that he had going on that they wondered, right? They wondered if it would hold up. Yeah, but again, the point is that's what he has now. That's what he's needed. So you need a transition that included that kind of coaching.
Right.
You know?
And I felt that a community-based day program that would incorporate a vocational piece would be ideal. And what I ran into were many roadblocks. That's hard to come by. I was kind of siloed into CBDS or work. Now that I believe is because of the staffing shortages at the CBDS programs and the work programs. But I was unable to find a program that offered him both.
Okay, well, let me ask you a question about that. Do you mind me asking
No.
as sharing? So right now, just to bring people update on piece before we explore deeper, right now you don't have something for him on, or do you?
He's on 12 CBDS wait lists, and he's been accepted to a new program, which isn't beginning until October. Quite a ways away from where we live, but I think it would be a wonderful fit. So the issue with that is transportation.
And is so, and is DDS in on this when you say the new program is going to start in October? Have they agreed?
They have not yet agreed. We asked, I had a call with New England Center and DDS on Friday, and we requested DDS please send the contract to this program.
So, and so you have that issue and transportation to get confirmed on top of that. What would you do between August 16th and October for Luke?
So that's really where I feel like I failed. I don't have a backup plan. And all these years I felt, you know, like I knew what was going on, which I feel like a lot of families, you know, I feel like I was ahead of the game and connected with all these different not agencies, but different social rec programs. And I don't have respite. So I suppose, you know, I am a single mother. I work full time as director of elder services in the town of Milton. So municipal job, can't work from home. And I am divorced from his father, who is involved, but you know, so I don't have a lot of support. I don't know what I'm going to do. I suppose I would try to find somebody to spend some time with him for the next month and a half or so.
So, and how is it going, like, given this is the situation, obviously you've got 12 organizations on a waiting list, so you've been doing some work, you've been hustling, clearly, you know, how long has that been going on for months? Your outreach with organizations?
Oh yeah, I started about a year ago. I started in July and I visited a couple of programs and had good feelings about them. And as we inched closer, and I was sort of discouraged by DDS to start that far out. But for me, I'm all about education and learning about what's going on and how things change so quickly. I wanted to be on top of things. And so as the year went on, it was, not giving tours, we have an extensive wait list, which I have to say again, I thoroughly understand. And I understand the plight of families that have been doing this for years, but you know, since COVID. And I'm just dismayed that nothing's been done because it's a crisis.
Yeah, and it's a personal crisis and it's a collective crisis, right? Because it's for you and for others. So when people knew you worked full time, I'm just curious that, you know, you have a service coordinator assigned to you or not, or is it a transition coordinator?
I'm still with the transition coordinator.
So that's tough because that person's, I don't know how many people, right? That person's managing transition for. And I wonder how, you know, this is the thing we've been talking with folks at the upper levels of DDS about since, I want to say November of 2021, about really having, you know, given the situation, right? Given that it's been 26 months, that some people are adults who haven't been able to return, right, to the services. Then you add the turning 22 folks on top of that, that we have a significant problem, you know, and we can't do business like usual. Now, again, I'm thinking that's the only, anyone else reach out to you? Any other person from DDS reach out to you, given your circumstances?
No.
Okay, and did you ask for that? Did you say, can you help me figure this out? I'm assuming you did, but I shouldn't assume.
Well, I've really been just dealing with the transition coordinator, who basically has just given me roadblocks everywhere I turn. And you know, it was only through a fellow parent at New England Center that I found out about this program that he's been accepted to. Since it's so far away, DDS, it's not on, I'm out of the South Coastal office. It was not on their radar. That was something else that I ran into. Just, I'd like to mention that Luke's dad lives in Brookline. So I was trying to find programs that would be halfway between Milton and Brookline. You know, he is on the list for 2 of them, but you know, it was a struggle to get a list of programs that were out of the catchment area.
Okay.
So I'm seeing that, Lisa.
Yeah, go ahead, Carrie.
You raised your hand.
Yeah, so my son just turned 22 in June. So I had to pull him out of school because of COVID. He did not do well with Zoom, wearing a mask and stuff. So I asked the school district to do like a self-direction, that I would hire someone to be with him during the day, 9 to 3. So then when he turned 22, I talked to my service coordinator at DDS saying I want to do self-direction, have those same people that are working with him just move him over to the DDS self-direction contract. So of course, with all the paperwork and everything, gave him ahead of time, it was a whole month because July 1st was a new budget. They weren't starting new self-direction contracts by then. So they used the flex funding to pay my workers for the month of June. Is that something that could be done?
So can I ask you a question, Lisa? Do they
Yeah.
actually give you support for 9 to 3 for 5 days a week?
Mhm.
Oh, wow.
DDS
Okay.
did?
Mhm.
I'm
Wow.
impressed. Okay.
Yep.
And you had found the staff. That's great.
Yeah, because I work
obviously-
full-time and
Yep.
yeah, so this is what he's been doing. It needs to be consistent. And then moving into the self-direction mode, it's 9 to 3. This is what he's used to. I can't change it. He's used to these people. I'm gonna lose those people if I can't pay them.
And what area office were you out of, Lisa?
I live in Rutland, so it's the North Central DDS. And I work in South Valley and I work for 7 Hills. I'm a family support specialist. So I help other families try to figure this out for their kids too.
Right.
And
And
you
I've
gotta
seen
figure out,
you've been participating for a while, off and on.
Yeah.
Yes, so kudos to North Central. It probably doesn't hurt that you work in the field.
I know the lingo. I know the lingo. I
Where's the
know.
school that your son went to? Was it a private school or was it?
Yeah, it was Wachusett District. So when he was in 10th grade, he was out of district. It was Center for Durham. And
Okay.
they got bought out by Devereaux. So Devereaux's a behavior school. So that was right before COVID. They changed everything. Half the staff left. It was ugly. And they did not listen to him. His behaviors got worse. So I had to pull him out. He
Wow.
couldn't even function. So yeah, so I hired one of his old aides since he was 3 years old. She contacted me about 4 years ago. I want to work with my kids that I worked with preschool and do the adult thing with them, bringing them out in the community and stuff. So I said, yeah, he's got another 4 years to go.
Well, hey,
I
look,
called her
that's-
earlier, so I'm like,
Yeah.
hey, you available now?
yeah.
Yeah.
Well, that's a success story. I'd love to hear more of those. And I kudos to the North Central office. Maybe Kerry, you might be able to give the North Central office, ask them to call the South Coastal office. I know, Christine, you were concerned about that because you don't have necessarily staff. So because Luke went to NEC, which is a distance, right? That's a distance from you and maybe a little closer to his dad's home, but it's a drive. You didn't have those same resources. I know they approached you about self-direction, but I doubt they approached you at the level that Lisa got, is my hunch. Yes or
Reach
no?
out to the school district because they got a lot of aides that are retiring and they want a part-time job. So I have 2 people with Johnson now starting. So with DDS, they says, how about a day program? I says, right now, he's not able to be around in a room like a school setting or whatever. So they says, well, how about if we do 2 days a week in a day program? So I have 3 days, 2 days with Mike, 1 day with Kathy. Mike brings him to the gym. He does more physical stuff because Kathy's retired. She wants to do, more ABA stuff. So then he's with the day program. So I got a day program that is closer to me, so I can drive him and pick him up. So I have to
Gotcha.
deal with bus issues because that was another thing. His behavior was so bad, he couldn't be on a bus. So, and then visiting other day programs out there, the Aspire one is more with CBD, you know, job training and all that. He was so bad that he couldn't even comprehend that just being in a room with others, he likes to draw, be calm, be around others. So you have to step back. I had to step back and say, okay, where is he at now? And then increase things slowly.
Right, right.
So,
Yep.
so
So
he's
thank
doing
you,
2
Lisa.
days. Yeah, because they didn't
Thank you.
do the 5 days of self-direction. So it was 2 days of programming and then 3 days of
Well,
self-direction.
that makes sense. Yeah, yeah,
Okay.
that I've heard of. I know Giassi's asking about the Walgreens job, but I'm assuming the job is near Neck, correct?
It is, but
that a-
Neck is willing to transfer him.
Oh, great.
But
Oh, that's awesome.
I need a job coach.
So, and I know you had told Carrie the idea of you starting self-direction now in the midst of this, when, and again, it's a different situation for Luke. Luke's been in a structured setting. He's enjoyed that through this period. So Lisa's stories is a little different, you know, Lisa's son, what he went through and needed.
Try the school district, because you might get some retirees that want to be a job coach, that want to be with him and to teach him out in the community and all those jobs and stuff.
But in Luke's case, Lisa, it might be different, right, than what your son needs. And for also for her, she's had him in this structured setting for so long, right?
But if
That
you get
just-
him to
it's a
know
little
other
more complicated.
people,
Yeah.
how about care.com? This is where we're having our families reach out to care.com and write a job description. Job coach, such and such a day's Walgreens pickup, drop off. And what do they do? So, and then that could be a self-direction paid person
Right.
to do that.
But I'm
No,
also
I hear
I
you.
wondering,
see that the Carrie Howland has her hand up too.
Okay.
Just
I just wanted to finish up the Walgreens thing, because what I was wondering is if Luke's employers at Walgreens would be willing to help, especially if they've gotten to know him and respect him and like him as an employee, they might be able to help in some way, like informal supports or something.
Right, like Leo mentioned, it is the store in Southborough, so it's not ideal. You know, Neck and Walgreens are willing to transfer him to a local store, which is fabulous. But then again, I guess with self-direction, it's overwhelming to me. I mean, I've attended DDS webinars on it, and I just feel like, you know, what is he gonna do during the day? I'd have to find, you know, a yoga class for him to take. I'd have to find things for him to do. And it overwhelms me, I guess. And I'm concerned about staffing, hiring the staffing. I know that this is where DDS is directing people at this time of crisis, but I
Yeah,
guess
you're saying it's just too much for you right now. So, I mean, I think for your road right now, and folks, feel free to correct me, but I think it's about figuring out which of those groups you're on a waiting list for that you can connect with and get them into soon. Otherwise, you're going to feel, you know, you and his dad, you know, are going to have to figure out a plan that then maybe does include self-direction at a time when you least have the energy to take it on, because you're also watching him, you know, and supporting him. So that's going to be a harder period to kick it off. And I know Joyce suggested that agency with choice is sometimes quicker, though I know people have struggled with agency with choice, you know, in the sense of unless you just get the right match and the right partnership with somebody, it doesn't, I can tell you because of the coalition we're engaged in, it's not always, it just is tough, especially in crisis. I think, so that's the thing where I'd ask service coordinator, the transition coordinator, can you give me somebody? I'm really at the wall now. I have a full-time job. My ex-husband has a full-time job. So that's number one, you know, and number two is one of those 12 places on the waiting list. And before we go to you, Carrie, and we're going to go to you because I know you've been carrying, you know, quite a bit for a while. I also want to, just in case Senator Barrett's on here, by the way, with a different name. I just want to put it out there, just in case. But I don't think so. So I don't know what happened, but something might have came up at the last minute, but I didn't want to ignore him in case he is. But anything, Kerry, would you add anything to what I'm suggesting for Christine? And I would like to, have you give her a little bit of a hand with that office too.
Yep.
Um,
Yeah, we
and-
talked about that.
Okay.
Well, the other thing is too, I think, what else can DDS provide during this wait time? I mean, you said this program's a decent match for your son, Luke, which is awesome. I mean, and if that's something you want to be willing to do and wait until October, are there things that DDS can help you put into place right now, like some individual skills instruction? It may not handle the whole 9 to 3 time, but if it gave you some significant support during this time. So I would definitely think that, let's get a meeting together with DDS and let's strategize on how to get through this next couple of months. So that would be the only thing I would add. But I think sometimes you've been, just dealing with the service coordinator, the transition coordinator. And, I just want to encourage families not to be shy about kind of going up that ladder, letting the area director know, well, this is not working for me. And this is the reason why. That it's totally okay, because that's what their jobs are. Their jobs are to support people. So, sometimes the transition coordinators just don't have enough decision-making, authority to be able to make things happen. So highly encourage that. But I just don't want to take away from Carrie, because I know she's been
Sure,
waiting very patiently.
I'm Carrie Howland, and I have a son, Bobby. I'm actually in the middle of a medical treatment right now. But just to sort of frame this, I hear everything you're saying, and one of the mothers was saying that Bobby hasn't been in a classroom since March of 2020. And we've done all kinds of creative things. Thankful forever for PACES, which is the Pilgrim Area Collaborative Extended Services, have been fabulous. DDS has helped a little bit, but just to give you an idea, we lost all IEP funding in April of this year. And we were marching down one plan. He's priority 1 plus medical. He requires the availability of medical care 24 hours a day, but not to the level of block nursing. And he's never been that way. He's one of these kids that is still here, but he falls in the middle. And so, we're getting a little bit of funding. We're privately paying for most of it because we kept all the ABA texts that he had. We had a very unique situation. But just to give you an idea, he is temporarily going to be moving to a medical group home, which is not our plan, to get the care he needs and to give me a break for the first time in 22 years. But there are no day programs willing to accept him. And like you, we did this well over a year ago, close to 2 years ago, and they're not even willing to look at the applications. So just to, sometimes it's I totally get where you're coming from in terms of what are you going to do? What are you going to do? And what they are trying to do, we're on the South Shore. They've been very responsive to our creative ideas, but it's sort of like, what is it called? Taking water from a stone. There are adults who are medically complex who still haven't gone back, that haven't been in something since March of 2020. So our competitive pool, if you will, for staff is just tough. And I'm not certain the legislators really understand that, what you're describing is pretty straightforward. You were able to visit. We haven't even been allowed to visit anything because of, the specific needs that he has. And, we're all treading water, but we've been doing this for well over 2 years. So I would also encourage, I'm on the South Shore, and just keep talking. We've had meetings with our transition coordinator and then all the way up to the area director. He's been very involved for the last 2 years, but there's nothing available. And I don't know, Leo. I think education, not just the legislator, but the general public, I don't think it understands what we're going through. You're providing services, Christine, for others, and their services are at risk because your services are at risk. So it's a chain. And that's all I'm saying to say is that, we found them responsive, but they just can't pull things out of the air for us. And it's devastating.
And Carrie, for you, your son, I mean, there's really a double whammy. Like first you were looking at a time when things were even more closed down when you first started.
Yeah.
And then even if you were looking now, because the places you're looking at have others with medical complications, they're probably more conservative about who they let in to visit. So you have that added, variable that's been blocking, for him.
Exactly.
So you do, I'm glad to hear there's a break, even though it's not the ideal break
Right.
from your perspective. I get it. A group, is that the respite place in Southeast Mass?
No, it's a medical group home near us. We live in Situate, and so it's in Norwell. And to give you an idea,
so it's a long-term home. It's really.
Oh yeah,
Yeah, gotcha.
But for us, it's a detour because our plan was shared living in a carriage house on our property, and we did renovation, we did all these other things, had a candidate picked out, and when there was no day program available, that whole plan fell through because you can't expect someone who's not their mom to do what we do 24 hours a day. So I guess the point is that there are a lot of creative models, and our area director, I have to thank him because from the beginning, over 2 years ago, he goes, you need a plan B, you need a plan B. And thankfully we did. And the other thing is because he was priority one, medical priority one, we had this idea of a medical group home as a backup. And that's a very complex process where the area directors meet once a month to see what spaces are available. And you could end up with a spot, on the other end of the state. The agency that was going to be the backup actually had to change their model, and they closed down the medical spot.
Wow.
So
I am on this video.
yeah. So
Hi,
anyway,
Why did they close it down? Because of staffing, do you think?
yeah, they couldn't staff the medical piece, and I think they consolidated 2 homes into one. So again, that wasn't ideal, but the point is that we're all stressed out, and DDS is stressed out, and we're so thankful for our staff who have continued to be flexible with us. But I think the public needs to understand this. There's a domino effect that's going to, it's my opinion that's why there's a labor shortage, is because so many of us are caregivers.
Yeah. Yes. This is the thing that I guess I have 2 questions. One is for us. What can we be more, are we not being aggressive enough in our advocacy? What do people think we should be doing more of? And, do we need to maybe take video cuts of, your story, Christine, to have someone edit this in my office, which I can do, and have someone edit what Carrie just said, and literally play that to the commissioner and to the secretary and to a couple of lead reps, the chair of, Persons with Disabilities Committee, right? Chair of Children and Families, because we've had a TV blurb, we have had some TV exposure, but it's not been enough. Obviously, you can't do this with just one exposure. And so that's number one. And then if anyone's got any more suggestions for Christine in this situation too, but I want to start with us first, systemically. If people think, we're being too low key, and again, we've been, trying to push for outreach. One of the things we asked for was having each area office have 2 times a month where there'd be group calls that people could talk about their present situation and have people on the calls work with the area office for some problem solving time. And that was decided a no-go. That was turned down as, I'm not really clear fully white, but I think they were concerned it wouldn't go well. There would become complaining sessions, and I appreciate that. I respect that. But I think our point was, well, if you work with people one by one, you may not have the ability to do that staffing wise, but having group problem solving and then incorporating other people into that from the community to try to figure this out might be the way to go. Because what Carrie said about the public not known is so true. Like, there are people with goodwill out there. Giassi suggests that it's maybe a little too far away, that Walgreens, but his point was, geez, I think people are good-hearted. If we would engage with people that have met our loved ones or friends, our family members, maybe they would engage with us too.
If I could just add one thing, is, what resources are available? Do you remember that the National Guard went into schools to teach? Why can't the National Guard?
And to drive,
And to
right?
drive and do all this. I mean, this is, I think it's the same thing, but it's in our homes. And it's what's not seen, but National Guard or City Year, there are educational programs, students who need internships. I think there's a way to amass the resources and the infrastructure that's already out there, but just redirect where it goes.
Okay, yeah, no, that's, I think we have to step up the volume then for that to happen, given the feedback we've gotten. Anybody else want to add to that or add anything about Christine? Thank you, Carrie.
I just, here Luke has been at NEC for what, 19 years, structured program. Luke doesn't have behaviors. He's autism, so he needs a particular way of being taught and a routine and that sort of thing. And I guess my big concern is what happens to this guy. I mean, we already know what's going to happen to your family, Christine. Thank you for sharing. But also, what's going to happen to your son? This is a big transition for him, and he's had a particular way of being supported that has been successful. And then because of the whole system crisis, he's going to have nothing. And it's just, very unfair. But.
Right.
So, by the way, Rosalie Eads just said that in terms of the closings that Carrie had referenced, the state operated medical home, I think that was a respite home. If it's the one I'm thinking of, Rosalie. She's saying that had to close during COVID, and 7 state operated programs closed in the Southeast region during COVID. So, so that's, that I didn't know that many closed. That seems unbelievably high. But I trust Rosalie's feedback. So we were having a contraction, early on in this crisis in Florida, 100 homes closed across the state. So I think we do have to raise the volume. I guess, Christine, we'll reach out. The South Coastal is also where Carrie's son is supported. So, and you haven't talked to the area director or anyone yet, I assume, right?
Right.
So, give you a little bit of a hand up, and it's anybody want to add anything before? And by the way, I messed up the invite to Senator Barrett. I want everybody to know in the last email, we were going back and forth. I put down September 8th in the email, so that doesn't help. And so it's my bad. So I just communicated with the office a little while ago, and that's what happens when you're multitasking, and things are changing. So
Could I ask a question?
Yes.
So the underlying theme that I heard from all these 12 programs and across the board is that there is no staffing. So I'm aware of that. I'd like to know what happened with the Chapter 257 funding. Was it funded at all? Or if you could just update me on that.
Sure. So the way that, first place, when it is funded, when it does come out, it's 230 million. And that sounds like a lot of money, but it's across human services. Now, in 2000, 2 years ago, and the residential programs are included in this. So chapter 257 is distributed in human services every other year for programs. So the programs that get it allocated this year is during this fiscal year, they get the money, right? Which the budget wasn't finalized till when? A week or two ago, the final budget. So, and then the folks that got the money this past year, they're, those are the day programs, you know. So what that does, the chapter 257 money, is probably get it to where people are being paid now with the crisis, $17 and change. And the reason I can pretty much guarantee that is 2 years ago, when these monies were up and the state allocated 160 million, we advocated for 220 million. And we advocated for 220 million 2 years ago because we felt that would be 10%. Okay. And if it was 10%, then, you know, thinking that the staff are about 70%, staff and fringe benefits of an average contract. So the way that money came out, just so you know, that actually got rates to somewhere in the high 15s dollars an hour. Think about that for a second. That's how bad. And we were asking for $17 an hour then for the basic staff. And of course, this nursing crisis, that's another number. Frontline managers, that's another number, right? So, you know, it's really been an uphill piece. So 230 million almost mimicked what we were advocating for 2 years ago, right? 10 more million. So when that gets distributed, by the way, in the 220 million, the 10% that we got of the 160 was 125 million 2 years ago, which left only 2 or 3% for all the other agencies. So DDS's residential did benefit at 10%. I can't believe it didn't have something to do with our advocacy, saying we needed to have 10% and 60 more million in an increase. And of course it had to do, right, with the advocacy. There's no other reason why we would get such a big share of the pie. And the other agencies, and then COVID hit in March. Now, maybe they would have added to the pie and put in 60 more million. Who knows? We'll never know because COVID hit in March. And all we knew, we were guaranteed the 10%. By the way, I say 10% on average. One agency told me they got 7% because their programs were historical programs that didn't have necessarily folks with challenging behaviors or special, whereas one of my colleagues on the other side who has a medical home and things like that, they got an average of 13%. Just to give you an idea, just because of the built-in costs. It's not like black and white, it's pretty gray. But at the end of the day, what's happened a lot, you see in the press, and I'm always surprised, they're saying providers aren't using the money for what it's meant to be. No, that might be true for some bad providers, don't get me wrong, but the state sets the benchmark. And then they make the increase based on the benchmark. And the increase they set a couple of years ago was $15.52 an hour. Just think about that. We walked into that rate area. You can find that. You'd ask for a copy from the state. They show you exactly what they base the increase on, because, you know, if you're an average person, you're thinking, oh, it's X dollars. That's a lot of money, you know? So the providers groups that when we supported this, they asked for 350 more million to get in the $20 an hour range for these staff and for nurses and frontline managers to get raises too. And that did not happen, okay? So, and now in the economic development bill, there was another 150 million to put on top of the 230 million. And that didn't happen because as you all read in the news, there was that tax surprise, right? 1986 Citizens for Limited Taxation referendum that won with 54% of the vote, that tied the hands of the Senate and House, right? Someone dropped the ball to Commonwealth magazine. It would have had to be enforced anyway, right? $3 billion would have had to happen. And we don't know how much will go back to the taxpayers. But unfortunately, it really put a kibosh on money that's needed during a crisis right now. So that's the backstory on that. I do want to share, you know, one of the things, yes, an editorial, you're right, Amy. Editorial is important, but we need a consistent strategy. And as long as people are working separately, I can tell you it's hard to get that, you know, consistent strategy. But we're gonna go ahead and I think step up the volume. I think this is, and now we're gonna be, before you know it, we're gonna be in the fall, right? It's ridiculous. So Christine, if you're okay, I think I'd like to edit a piece of this to include your story, if you're fine with that.
Yes,
And we'll share it, and we'll ask Katerina Daly to help us do that. And Carrie, I'm sure will say, okay, but I'll confirm that with an email. She's off picture right now because she's doing some stuff with her son medically. But I think that's our game plan. That's what we should do. I also want to remind people, and the reason we have these things up, and Giassi had his up, is we have on the 11th, between 5 and 6, we'll have 6 and 7 p.m. on August 11th. Giassi will do an introduction. We'll have David Falcone, who formerly worked for Senate President Murray, Terry Murray, if you remember her, and also was in the Treasurer's office. He will be the moderator, and we're going to have the Attorney General candidates. And it looks like we'll have a surrogate for one of them, and we'll have no Republican appearing. He hasn't formally turned down, but he hasn't communicated with us. But we do have some of the candidates coming on. We're looking forward to that. And then we hope to have the governor's forum in September. I think it's September 8th, Giassi, if I remember right. Kathleen, okay.
correct.
And, and I just also want to remind people, just we do our advocacy with your support, how important it is, and appreciate the support that we do get. And look forward, and Kathleen just put it up here, the registration and stuff, and we can send out the PowerPoint later. So, and again, my apologies to all of you for not having a senator here too, but I think this pretty much, I knew we would have a lot to talk about today. We have a lot to do too. So Christine will be thinking about you and your advocacy for Luke. And all of you, feel free, if you are also in a similar situation and didn't speak today, please email us. You can email us either at arcmass@arcmass.org, which probably is the easiest thing to remember. And if you find my last name or Kerry's or Kathleen's last name, Kathleen's is the trickiest, it's the first initial, but for Kerry and I, it's Mahoney and Sarkisian at arcmass.org. Please let us know of your situation. And, we'll push ahead, and we'll keep pushing as we have been trying to do. Clearly, we got to raise the volume. So thank you for joining us and sharing your story, Christine. Thank everybody for being with us today. Take care. See you next week. We'll have Rep. Sean Garbley. We also will be talking about this topic again, and we will share some of what our next steps are. And would love to have, we'll probably have another story. We might do a story we've taped already and put that on, because it's one of the folks that's been really active with us and with Mass Families for years is again in a similar situation as well.
RJ, what
All right, everybody, take care. Bye-bye.
Bye.